Right, hi everyone. Hi Ronelle, hi Therese, and hi Zola. Thanks very much for joining Women and Men Against Child Abuse in our offices here in Sandton. And this is the fourth in a series of podcasts and YouTube clips for our 16 Days of Activism campaign. And it's a very difficult topic to discuss. So we're going to take it quite gently and we're just really going to have a conversation. So the theme of this in the 16 Days of Activism is around the vulnerability of boy children. Now, we've learned about the vulnerability in terms of homicides and imprisonments and drug addictions and so on. But this is really about suicide, and it's about how trauma contributes to suicide and how we can try and prevent that going forward. Both the trauma, where possible, but even if there is trauma, how we prevent the permanent solution to a temporary problem. So we're going to start with Teresa, and it is one of the bravest things I see people do is to come out as a bereaved mother to talk about losing a son. So she has started an organization which she's going to tell us about. She's proudly wearing the branding, and I'm just going to let Teresa talk to us about her campaign, which is the STOPS campaign, and about her son and about how that gave rise to what she's doing at the moment.
Thank you, Luke. Yes, out of very painful times, we've tried to make sure that we try and focus on a positive outcome. It's very devastating to lose a child, and I think even more so to suicide. And, you know, one can come to peace with his passing, but what I'm really struggling with is actually what got him there. And it boils down to, for me, trauma takes lives. And it doesn't discriminate. Cross race, age, gender, trauma is a lifelong infliction. And the younger you are when you experience the trauma, the greater the impact. And that is why we've started this organization called STOPS, which is Stop Trauma of Pupils in Schools, specifically focused at the younger ages of when the trauma takes place. And very often that trauma may be suppressed, and you may notice some signs, but it's very difficult when the trauma is suppressed. The child can't articulate or remember what has happened to them. They know they feel an intense sense of discomfort, and they have intrusive thoughts, but they really just don't know how to come forward. And in particular, boys are even more difficult in that regard because they grow up in a culture of silence within schools where you don't tell and you don't say anything that could possibly be remotely bad about your school. So they're caught in the silence of shame. And it's a really challenging situation because they don't want to be that guy. They don't want to be singled out in any possible way. And they fight just to manage their complex PTSD symptoms, which can be anxiety, can be racing thoughts, hyperarousal, a lot of things that can actually present or look like other issues. And because this trauma is suppressed and or they are silenced by shame, it's very difficult to understand what the actual symptoms are coming forward as. I don't know the stats, but I would hesitate to guess that South Africa is a highly traumatized society, and that we often have misdiagnosis of either bipolar, because that is a registered condition, and or substance abuse, or a variety of different things. And the real challenge is that complex PTSD has a lot of overlaps with low mood, negative rumination. A lot of different presentations may either look like bipolar, or it may also present with psychotic features, which then becomes even more complicated to diagnose and tricky to diagnose. And I think we need to actually find a way where we can help trauma speak, because boys and women and everyone doesn't have a language for trauma. You're overwhelmed by intrusive thoughts and hypervigilance, and you just can't get to communicating what the issue is.
Absolutely. Now, I just want you to talk to the one specific element of it. So, as parents, and I've met both you and your husband, and I've been to your home, and the sadness and the pain is, it's palpable in your lives. And the one thing that struck me in talking to you is that you as parents completely trusted certain systems, and I'm talking specifically about the schooling system and then the medical system, and how that system, because you had nothing else to do but hand your child over to those systems, and how that has caused you and your family enormous trauma. So maybe just to mention the schools and the hospitalizations.
You know, as I say, it's very difficult to lose a child, but when you lose a child in such traumatic conditions, you are completely feel betrayed. You feel that you've given your most precious asset into the care of one of the best schools in the country, and they have great education, great sports, but none of that matters if they're actually emotionally damaged. And for us and for STOPS, the brainstorming was around how do we actually make schools emotionally safer? And not just in high school, but from little. How do we get mindfulness and breathing and coping strategies in, and also put in place a very important independent counselling and advisory service that is appropriate for children to raise their concerns. Because the last thing any young boy wants to do is actually take on the school or go to the school therapists and actually challenge the system that is in place, that when they're bound by secrecy. So, that was for us a real shock, and knowing that they were not taking care of our child. That's essentially, we loved the education, we loved the academics, but my child took his life because of trauma. Well-educated, very bright boy who was accepted to study physics engineering internationally, was due to start this year, and all of those dreams were taken away from him by sexual abuse when he was 10 to 12 years old. I think the further failure that you mentioned, which we've spoken about, Luke, is the complete desperation and in trying to get him Julio support. At the time of his death, I think he had been hospitalized 12 times. He had seen 6 different psychologists, and more, 6 different psychologists and 6 different psychiatrists. And each one had their own little interpretation. I can only say that the ones that knew him really well, being Dr. Kelly Owen and Dr. Biagio Longano, actually understood who Julio was and why he was presenting in this way, and properly diagnosed him. But between the facilities, he was ADHD, he was bipolar, he was psychotic, and in essence, nobody really got down to what caused this. Now, we can treat the symptoms of lung cancer after someone smoked for years, not very effectively, but complex PTSD is a lifelong infliction, and it's extremely difficult to manage, extremely difficult for the person. It's very much an infliction of the autonomic nervous system, so it is not controllable. It's the anxiety, the racing thoughts, the hyperarousal is not within the child's control. Of course, there is help, and that's the whole aim of, I guess, what we're all here to do, is to try and put in place things that can actually support the detection, the diagnosis, the early warning signs, and put in place the right strategies to actually support a child who's gone through a trauma.
Absolutely.
I mean, trauma can be many things to many people. It doesn't quite have to be as extreme as sexual abuse. It can be bullying. It can be belittling by teachers. It can be a variety of different things. And I think if you ask anyone in their adulthood, they would all have a story to tell you of how they felt bad at school at some point, whether it was bullying, whether it was belittling or being excluded from a team. Those developmental years, small things can actually really, really impact your child for the rest of their lives. And for parents out there, I'd really love to send out the message that please get your child help, pay attention to small signs, and even when you get them help, make sure that you're engaged with it, because in our last engagement where Julio took his life, he was admitted as a high-risk patient to a general psychiatric clinic, and he took his life in the clinic where he was supposed to be safe and observed. He was improperly medicated, there was confusion, and there was no excuse really, because at that stage we did know what the cause was. We knew that he had been sexually abused. The school had come forward with a disclosure, and all of that information was submitted to the medical facility and the treating doctor. And yes, and this probably is a bit biased, but sometimes the medical professionals can be a little arrogant in wanting to do the treatment their own way, which I guess is what's required, but not taking into consideration very key factors that led up to my son taking his life.
Thank you for that. And I think that's a sort of a perfect pass on to Dr. Price-Hughes. So, Ronelle, I think if you could just grab the talking stick. For me, you and I have worked together for many years, and the thing we need to get to with STOPS is to, as the professionals, to assist parents and young boys, frankly, to find ways when they have these adversities of childhood to get the right help, to try and give them the right language. So in terms of psychiatry and psychology and treatment, what message do you want to send to parents and also to young people who will probably watch this as well, around trauma in childhood and how best to seek help?
Thanks, Luke, and thank you for the question. And I think I just want to acknowledge that I think it's very hard to talk about something so personal. I don't think I've got all the answers, and I think, unfortunately, the literature is supporting everything that Teresa is saying. I think, especially COVID has just exacerbated everything, and I think it's been highlighted that especially boys are so vulnerable in terms of mental health. I think there's a few things that make it more difficult. I think there's something around the fact that they are not able to always let us know how they're feeling. I think they then present often with sort of more risky behavior or more aggressive behavior. And I think instead of caregivers and teachers and therapists acknowledging what's behind the behavior, that the behavior is a way of communication, I think we are so fixated on the symptom that we are not able to see what's behind it. So I do think, in a way, I want to say that we need to figure out a way to be more preventative. And how can we do that? So I think if you look at all the literature and all the things, we need to figure out a way that our schools, because I mean, children spend a huge part of their day at school, can be more aware. More aware, because the system is picking up how girls present. I think that the system is really geared towards, that sort of depression, anxiety, the way girls present, and they're able to respond to that. I think the way the boys present is causing confusion, and then we are responding to the behavior. So is there a way that we can, maybe through stops or through other ways, educate people who work with children all the time, that we can identify these kids earlier? And then we need to figure out a way how to help the boys specifically, and girls, how to come forward in a way that they feel safe and heard. Because, I mean, I think we also know that these boys, it's not even just a stigma from outside. There's self-stigma.
Yeah.
There's self-stigma from the way that, how is a boy supposed to present? Boys are supposed to just get on with it. And that self-stigma comes with shame. I think you mentioned that. So there's shame in the fact that I'm not able to cope the way I'm supposed to be coping. And I think there's a few things that they are saying. I think the one thing is, how do we find a therapy or intervention that talks to that connectedness? And I think we've spoken about that quite a bit in COVID. So what boys and girls, and I think adults, look for is connectedness. And how can we find that connectedness in a way that is not detrimental to them? Because if you now as a boy present with behavioral problems, it's very easy for you to get into that sort of a more antisocial conduct group, which then will lead you down a certain path. There's such a huge link between how men cope, or boys cope, with trauma. It's often got to do with alcohol, substances. It's got to do with risky behavior, which then leads you into another path. There's a huge link between substances and mental illness. And then, unfortunately, there's also a lot of research that shows that boys and friends are not able to, in themselves, but also in their friends, identify when their friends are struggling. So they're not able to let people know, listen, I'm worried about my friend. Where girls are much quicker to do that. I mean, a girl can quickly say to their mom, you know what, I'm a bit worried about my friend. She's different to how she was. Where a boy would suddenly go, I'm not going to get involved with that because it's too complicated. So I want to sort of say, I don't think we've got the right things in place. But I think all of us need to go out there and try and figure out, how can we go into the schools, how can we go into these spaces and create a language to identify symptoms, reduce the stigma, reduce the shame, and then figure out a treatment or intervention. And I keep on thinking about your boxing program, because to me that just is such a beautiful program, in the sense that we're connecting through sport. It's helping us to be healthy. It's bringing us together with sort of pro-social friends. We're focusing on what's important. How do we care for each other? All the things that boys sometimes see as not masculine.
Yeah, a bit girly.
So you are weak if you're going to be all empathic. So how do we have strong role models, male role models, that show you that, you know, you're not weaker, you're not less of a man, if you are able to care for each other and acknowledge each other and support each other through sports. I know sometimes sport can be the place where the trauma is. And also we need to figure out then, how do we make sport a safe place? Because we don't want to lose sport, because sport is where we can support kids. I mean, kids who sometimes struggle, this is where they found their people, their connectedness. So we need to look at connectedness. The other thing which is interesting is that they're talking about how to involve the families, but especially how to involve the male caregivers and the fathers.
When present.
When present, and if they're not present, how do we identify then important male or mentor? So I'm not saying it has to be a good father if you want to involve the father, but we can identify within a school setting. We can identify seniors that can look out for a younger learner. We can identify mentors. So I do think, and I think what we also need to look at, and that's maybe from my own experiences, there are so many young coaches around who do not have the tools to be able to support these young boys the way they should. And they are thrown into the deep end.
Exactly.
And then the way that they respond can sometimes be quite masculine. And then there's sort of, in that whole sport code feels that this is what we should be doing. So I think we have to focus on preventative. I mean, that's where I think, if we get to a point where we're worried, I do think there's a lot of places to go to. I mean, I think we can give out the names and the numbers. I think that's not what we're here for. But I do think we have to really think, how can we push for boys and mental health in a way. And what they're also saying in some of these things, boys they don't want to talk in
100%,
therapy.
yeah.
They want to use their humor.
Yeah.
They want to feel competent. They can't feel weaker. They can't go into a therapy where that's going to make them feel lesser. How do we have a therapeutic thing that makes you feel competent? It uses male humor, male connectedness in a way that is therapeutic. I don't know if that helps.
It helps a lot. I just want to pick up on that last point because I think it's a significant one. Because there has been a movement, you and I have sort of had brief discussions about it, about how men are essentially under attack in terms of particularly kind of the new messaging all over, toxic masculinity and so on. But what comes with that is often the maternalization of care, and that men don't want to enter these caring professions because they also are often not selected for them, because the selection process often favors a very maternal approach because that is what the training is. So there might be a place for different kinds of interventions that are not necessarily the formal kind of psychological trainings to master's levels.
So that also comes up in the literature. If you're choosing to be a male nurse, you are seen as lesser.
Right.
So it's not the typical masculine way to go. I do think social media is really impacted on things so significantly. I mean, I think I spoke to one of a boy's mom the other day, and she said, my poor son doesn't know what to do.
Yeah.
Like, if he gets to a door and he opens the door, the girl will say, what, do you think I can't open the door? If he doesn't open the door, they go, don't you have any manners? Like, I think these boys are so confused about what they have to do that I really think it's a minefield out there for our teenagers. I mean, boys and girls, like you are so quickly going to be cancelled. You're so quickly going to say the wrong thing, do the wrong thing. And I really am worried that in schools, there are no safe spaces to discuss these things. We really need to figure out a way where children, young children, older children, in a safe space can learn about each other, can talk about things without the risk that something will get taken out of that conversation and held against you and taken out of context. So I do think we have to look at how can you be a man in a more soft profession? How can you still be a man by caring? And I think we have to find that balance, and I think the balance might be through identifying seniors in a school setting, mentors, prominent people that can come out and can come and share. I think there has to be something around that, but we do need involvement of men that can show both sides.
And I think that's a good move to Zola. So Zola, if I can now move to you as the sort of final voice of the day. You have a particular interest in preventing suicide, which I would just like you to talk to. But I think what Ronelle mentioned around boys and opening doors and not opening doors, it's not just that men are confused about whether to open doors or not. They're not sure which language to use anymore, because what happens is it's almost like the language that has been generated, I think particularly online, has foreclosed any conversation, because anything you say comes from a position of, the original sin. You can say nothing right. Now, you are involved with Panda as well, so there's two components to your input. And your involvement with Panda, I think, allows for some of the things that Ronelle is talking to, a little bit of anonymity, testing the waters, etc. So maybe if you can talk first to your particular sort of interest in suicide and what you're wanting to do about that, and then if you can maybe just guide our young men where they can at least try out these therapeutic spaces in ways that are a little bit less threatening. Sure.
So I know we might be running out of time, but
No,
I
that's
think
all good.
what you're raising is very important, because the studies also show that how many boys who successfully committed suicide, because there's definitely an increase in depression and anxiety and suicides and fatal suicides, because that's how few of them presented to healthcare services before, because men do not go to doctors.
100%.
So, but they did show that boys and men are more likely to go online. Yeah. And I'm guessing that's where you come in. Correct. So I think that it's sort of completely supported by literature that we need to explore those options.
Give it to you for a second. I think that it's absolutely, sorry, I have to add
no,
here,
please, go.
is that I think that the critical thing that's going on right now, and thank you, Luke, for facilitating it, is that we need to start with more awareness. We need to break the silence, because we cannot actually find solutions unless we break the silence, we build support, and we get interest actually by parents, by schools, by boys, into actually being a healthier, more emotionally regulated person. Until we can break that stigma and that actual focus on trying to actually do something about this very sensitive, difficult topic. And many people have asked me, it's like, why have you come out to speak here? It's in honor of my son, who actually would have wanted to help people. And it's a very difficult path to choose, but it's very important to actually, for us to be having this conversation, for us to be putting the support behind collaborating and clarifying what we can do to actually stop abuse and actually put in the structures in place that give boys the emotional empowerment to actually speak their heart.
Absolutely.
On that note.
Right, so you will have the final word.
Okay, thank you so much, and thank you for this opportunity to speak on these issues. Coach Luke would know that I have a personal stake in the topic of suicide, as I lost my mom to suicide, and I've had my own interactions with the topic depression. So it is something that's very close to my heart, and of late I've really taken an interest in men's mental health, and that for me is so important, because that space it is like a minefield. It is like just an enigma, an unknown, and men should not have mental health, and that's what we've grown knowing. As kids in school, the softer man or the softer boy was always teased and seen as different, and we always praised the tough and rough boy, and for me, it's not even about being rough or tough or soft. It's just about being able to acknowledge when you have uncomfortable feelings, acknowledge when you are not feeling okay, and we need to open those spaces for men. So what I would love to work on is a podcast for suicide, in terms of the people who've survived their loved ones who've committed suicide, and as well as people who are struggling with suicidal ideation and also depression, where we get a space to talk and we get a space to express ourselves, and make it okay to talk. Because I think another thing that that hinders any sort of progress in terms of people coming out and voicing their struggles is that there's just the stigma about having a mental health issue. And the stigma isn't going away, no matter how hard we try to talk about it, no matter how hard we come forward and say, I've struggled, and say, there's been this. People still look at you and frown upon you. And I think we need to work together as people who are in these spaces, as activists, to say it's okay. And starting in schools, I think even in schools, even in girls' schools, girls don't feel comfortable talking and coming forward. But I think mostly in boys' schools, because the culture in itself is creating the strong, tough man. And if you are coming to a teacher or a sports coach with an issue of, I'm actually not feeling okay, I'd like to sit this one out. Men must be strong. You need to just power through it, push through. And I think we need to think about that language of how do we then speak to boys, and how do we encourage them to be able to feel safe enough to say, I'm not feeling okay, can I sit this one out? And that's okay. I always say to the kids, it's okay if somebody says to you they're not okay to talk about something. That's fine. But it's also okay if they say, I want to talk about this, or I feel this way. It's always okay for you to be able to express yourself the way that you are feeling in that space and time, as long as it's respectful. So I think having Panda, which is it's very big on anonymity, tongue twister. But I think those are platforms that we need to engage in terms of young people, because I know that these spaces are also always directed at the older generation, but we need to open spaces similarly to Panda, where young people can come on and just vent and or listen to other role models. Especially, I think young kids, they really respond to these role models who are big and are great in the social media space. And I also feel like that social media space is so dangerous, because all the role models are these fake living people who don't want to come out and say, I am struggling, or I struggle with this. So we are fighting a very, very tough battle, where we are trying to counter all these messages that are coming through. And it's like society doesn't allow you to be real. Society doesn't like real. Real is uncomfortable. Real makes you feel like everything's wrong, and everything is wrong.
Yeah.
So we need to acknowledge that, and we can't change anything if we don't acknowledge the issues that are facing. Yeah.
So I want you to have a concluding thought for your part, and then each person's going to get an opportunity to have a last word. So you the last word for now, and then we'll go backwards. Your reflection on, so Christian's our boxer, who's our mental health ambassador at the gym, and on the conference you held around the fashion show, and how things like that can also promote men's health. Simple things like fashion.
Yes. Okay, that's a brilliant point, Coach Luke. So we had the men's mental health conference / fashion show, and I think that is the essence of how I was like, yes, men's mental health is the thing. And I think, using fashion, it seems like very and we're going into that social media space as well now, but we can use fashion, something like fashion, for good, where we promote men's mental health, we promote talking, we promote speaking out, and we had a nice turnout of young men in that setting, in that conference. And that for me was the essence of it, where young men got to listen to great speakers. They got to engage with topics. I mean, we came out with issues such as cultural norms, gender identity, or gender. Yes. So, things like that are so embedded in our society that we need to work at debunking, if that's the correct word, but debunking these norms that have been created over time. So using Christian's brand, Unbothered, to spread the word, but also in a non-threatening way, because with young men, they're always so threatened with this word mental health. I mean, with the life skills that we do, the boys are very engaging, but the minute you get too deep, they'll tell me, ma'am, this is too much for us. And I love that about them, but I understand as well they're just places they don't want to go, or they're not ready to go. So you have to be able to gauge where they are, and using things like fashion and boxing, that in itself is a way of introducing a topic that otherwise would be very threatening to young men. And we need to start, like you were saying, Dr. Price, that we need to find alternative ways. That's the only way, because even with the girls, the traditional way is just not working. So we need to look at these alternative ways of having these young people speaking out and engaging with the hard feelings and the hard topics. Thank you so much.
Pleasure. Thanks, Ola.
Thank you. That's amazing.
Last word from you? To parents or to young men?
To parents, young men, and to supporters of child protection and empowerment of men to be emotionally vulnerable, I think is where we really need to get to. And it's a long road, and it has a lot of different angles. But I really love what you're saying, Zola, is it's also about making it cool to care, and you'll never make quite the inroads if you don't meet the young generation where they're at. And it would be really amazing, not only to get necessarily sport role models, but music role models, fashion role models, and people who have a voice and respect amongst the community from a variety of different angles to show that it's okay to be authentic and different. I mean, who wants to be normal when you can be exceptional?
100%.
And we need those role models to actually take up a little bit of their time to actually hold the flag up and say, you know what, it's okay not to be okay. And we are here and you can get support.
Perfect. Final word from you, Doc.
That's a difficult one. I don't know, I was trying to think when everyone's talking, and I think there's so much opportunity out there. And I think for me, it's always just to think that I think the parents must also be kind to themselves.
Yeah.
Because
Absolutely.
I think it's also a minefield out there for the parents.
Absolutely.
And there isn't a perfect manual, and there isn't a perfect way, and we're not going to always know. And teenagers are tricky. I mean, they're going to sit in their room, and you're going to think, are they isolating? How do I give them enough space? Or I'm going to And I think it's just important to talk. Find your support team, find your people to talk to, bounce things off each other. But I think that's what we have to just keep on thinking together. I mean, I think we also mustn't go to the risk that, I mean, there are some very boys who's also going to struggle.
Yeah.
And they don't have to be different.
Yeah.
So I think we must also not go to the side of you have to be a certain way.
Yeah.
So I think that's the risk of,
Yeah, absolutely.
I mean, I think we just have to, everyone is themselves, how do we, and we do not have enough psychologists. We don't have psychiatrists, we don't have psychologists to be able for everyone to be in therapy. So how do we figure out a way that we maybe reach out to the people who work with kids and support them? Exactly. So I think we have to just keep talking, keep trying. There's no point where you've ruined it for the rest of your child's life, fortunately. So we can always get up, and there's a lot of value in showing children that when we've made a mistake, how do we repair?
100%.
And if we've done something that maybe we could have done better, how do we go back? And I think that's what we need to know. It's just ongoing. I don't know if that's maybe a good way to stop.
It's a fantastic way. So you have just tuned into the last in our 4-part series from Women and Men Against Child Abuse for the 16 Days of Activism. And we want you to watch out for Zola's podcast. We want you to watch out for stops. They're going to be in the media around the criminal case, and I want you to provide support to them. And then also to heed, I think, the final words of Dr. Price on 2 levels. The first level is that parenting is hard. And parenting in the modern world is hard. We talk in psychoanalytic terms of a thing called the third in the therapeutic frame. And that at the moment is being online. And you need to understand that is a third intruding on your parenting all the time. And you need to provide your children with a script that you want them to have, so they have a script that counters that script. Okay, doesn't mean as a teenager they're going to choose your script. In fact, they're probably not. But at 25, they look back and say, at 15, I'll never be like my parents. At 25, I'm exactly like my parents. So there's a level at which we, to be a little bit sort of cliched, is we will only rest under the trees of the seeds we plant today, and we are gardening, with our young people. So we must not be like that biblical person just threw seeds randomly. We've got to do deep work, more like mining rather than farming. So, and that requires relationships. And you as parents are the single most protective feature for your children. But when things go wrong, you are not necessarily the cause. You have handed your children over to people that you trusted, and we need to hold those people accountable. So thank you, Renelle and Teresa and Zola, for joining us. And we look forward to a 2024 where we are going to continue these conversations we have begun. Thank you and cheers.